Now let's talk about gains and goals, okay? What gains are there to be expected and what goals do I recommend, okay? Now, typically after the first procedure, and I had mentioned this already briefly, but let's talk about this again when I mentioned my patient and his story. Most men are around 4 to about, well, actually the real average is 4 3/4 girth, okay? So the girth really is right around in between here, 4.5 and 5. So that's really the range. I mean, usually most guys are around here, 4 to 5 in general, but the real average is closer to 4.75 circumference, okay? 4.75 inches in circumference and so forth, all right? So now, after one treatment, we expect you to go from 4.75 to at least around 5.5, okay? Maybe somewhere in between 5.75, right? A second treatment, we expect you to go to about 6.5, which is right here, okay? Maybe a little more, depends on how much collagen you make. So that's just the 2D version. So let's assume for a moment you're about 4 1/4 in circumference or somewhere in between. This is a little bit bigger, 5 1/4. So let's just say you're about 4 1/4 or 4.5 in circumference. The first treatment, I expect you to get to about, this is 5 3/4. I don't know if you'll get to this, but you can come close to this, 5 3/4 in girth. And the second treatment, we would want you to get closer to 6.5 or 6 3/4, roughly. These are just the models I have. But you'll roughly be, I'm sorry, whoa, that's the 7 3/4. This is the one. So you were probably saying, wow, that's a nice jump, you know, nice gain. It's actually, here's the 6 3/4 here, okay? This particular size, okay, it could be 6.5 to 7, but this is 6 3/4. This is an excellent goal. It usually takes 2 to 3 treatments to achieve. This here is very stimulating for intercourse. And let me explain why and the anatomy of the vagina so you can understand why girth is so more important than length, okay? And here are the reasons. If you look at the anatomy, the female anatomy, okay, I'm going to show you this diagram here. It shows the pubic area here of the woman, and it shows the vaginal opening, okay, and it shows the clitoris right on the top over here, okay. That is a normal anatomy, okay. Now the clitoris, which is sitting right over here on the top, okay, the vaginal opening is here for intercourse. The stimulatory mass or tissue mass is right over here. It's highly stimulating or stimulative for producing orgasms and so forth, okay, or resulting in orgasms, right? Now, if, for example, you were to have intercourse, right, the penis would obviously enter into the vagina, okay, but the situation is this: you only see a very small portion of the nervous system that stimulates orgasms. That's the clitoris. But if you look throughout the whole canal of the vaginal area, there's a whole branching nerves. There's a branching network of nerves that go along the vaginal canal. This here will demonstrate in a different view. Difficult maybe to see this, but I'm going to show this to you anyway. Right here is where the vaginal canal is, okay? And it's only so long because there's a cervix. There's a uterus here with the cervix in the way. So if you're longer than 6-7 inches, you're going to be hitting into that cervix or uterus area, okay? But here's the key. The vaginal canal that's right over here is lined with nerves, okay? So the clitoris is just the tip of the iceberg. You're only seeing a very little portion of the neural network that causes orgasms. So if you were to have intercourse with an average size penile girth, okay, there's only so much vaginal wall stimulation that will occur. Now imagine now going in with this, with 6 3/4 girth, you'll be touching all 4 walls of the vaginal canal, and that's why many women will have multiple orgasms with something like this, okay, this particular size. That's why I recommend this. I've interviewed hundreds of patients and spouses and men who started out with this size and you know, wound up with this size. I even have men going to the 7 3/8 size. I even have men larger. I even have men this size. How ridiculous this is. Almost 8.5 inches in circumference. Okay, I do have men this size. However, this is a problem because this is difficult now to enter into the vaginal opening and canal. Okay, I have men that say that they cannot enter into some women with this size. Okay, I don't recommend this. Okay, even this would be the high end 7 3/4. Okay, this is almost 8 3/4. This is 7 3/4. Big differences here. Okay, so my recommendation is to stay within the 6 3/4, and the very high end would be the 7 3/4. Okay, and again, if you recall, we're starting out with this. Let's keep this in perspective. Okay, here's our 4 1/4, right? I mean, these sizes are tremendously different. There's a huge difference here in regarding size change and, of course, response or stimulation of the vaginal canal. Okay, when you understand this, that girth is far more important than length, you'll not worry so much about your 5 or 6 inch normal average length. It's perfectly fine. Okay, it might look better, or to have something longer, but functionally it's not better. Okay, functionally it's not better. So let's demystify that right away. So don't worry about your average 5 or 6 length. Perfectly fine.